The Democratic Labour Party is appalled by the continued inaction of Junior Minister Davison Ishmael and Health Minister Dr. the Most Honourable Senator Jerome Walcott in the face of a growing healthcare crisis of a scabies outbreak at the Geriatric Hospital. The elected ministers must be held responsible for the systemic failures currently taking place under their direction, even though the Ministry of Health has released a sanitized and protective statement through the Chief Medical Officer. The DLP categorically rejects this insult to the truth and to the frontline healthcare workers who continue to perform heroically with no support from the ministers responsible. To be clear, this is a crisis supported by facts from our reliable sources inside the healthcare system, not a political intervention. These first-hand reports depict a hospital undermined by institutional negligence and government inaction, and a healthcare facility functioning in unsafe and unhealthy conditions. We are profoundly disappointed to find that nurses were only handed the scabies treatment solution on Saturday, June 7, 2025. This is 5 full days after the Democratic Labour Party first raised the alarm publicly. This reactive approach in the aftermath of public disclosure demonstrates governmental dereliction rather than readiness. We were also informed that the therapy was only given when nurses sign in for duty, a highly worrisome administrative posture in the midst of a potential public health threat. The CMO, a governmental servant, may have made a statement regarding the scabies outbreak. However, responsibility lies with the Minister and Junior Minister of Health, who play a crucial role in leading the response to this outbreak, including shaping national policies, ensuring public health preparedness, and coordinating with various sectors to effectively manage the situation. However, both of them have stayed deafeningly silent while our elderly suffer in poor conditions. Where are the voices of Dr. Walcott and Davison Ishmael? Where is their leadership? Where is the compassion they owe to the Barbadian people, particularly the elderly who built this nation? Our sources report that clean linen and clothing sent to the QEH for laundering on Thursday was only returned on Tuesday, 10th of June 2025. This resulted in some wards operating without sheets or towels over the long holiday weekend. Basic medical supplies like gauze, alcohol, and gloves are in critically short supply. This is not the result of misinformation. This is the lived reality of staff working under impossible conditions. And yet, in their official statement, the ministry dismisses these facts as exaggerations and isolated issues. As we have said from the outset, this is not about inciting panic. This is about demanding accountability. Scabies is a treatable condition, but without urgency, transparency, and basic resources, treatable conditions become deadly threats. This government has failed the elderly. It has failed its healthcare workers, and it has failed to live up to the most basic standards of leadership in a time of need. We will not sit silently while those who built Barbados are now neglected by those entrusted to protect them. The Democratic Labour Party stands in solidarity with the patients, families, and healthcare workers of the Geriatric Hospital. We demand action, not apathy, from this government.